Hi everyone, Dr. Shook here. I hope you're doing well today. In today's live stream, what I want to share with you guys is the number 5 cause of knee pain. Now, this might actually be the form of knee pain that you're most familiar with or the potential causes, but I just want to show you real quickly in a drawing exactly what I'm talking about. So this is a picture of a knee with the muscles, the nerves, and the cartilage, but let me show you the ligaments, okay? So let's say this is the upper bone of the leg here, okay? This is the top part of the knee. This is the lower bone, the tibia, so this would be your shin, this is your thigh. Here's where the knee comes together. Now, when the knee comes together, you have several ligaments that stabilize or keep the knee together, okay? So you've got meniscus, which is a cartilage between them, okay? So let's just draw it like that. This is not anatomically correct. Then you have, let's say that this is the inside of the leg. You're going to have a ligament that connects here. And that's called the medial or inside collateral ligament. You're going to have another ligament on the outside. Okay, that's the lateral collateral ligament. Then you're going to have 2 ligaments inside that cross. Okay, and they cross and it's called the ACL and the PCL. Now those ligaments keep the knee from shifting forward front to back. Okay, so you hear a lot about like the ACL and the MCL and the ACL inside. It's one of the crossing ligaments being injured in football because a lot of the types of injuries that occur damage those ligaments, especially the ACL, the anterior cruciate ligament. Now, if these ligaments are damaged, what happens? You're going to get looseness in the knee, right? And on exam, you can test those ligaments by pushing, pulling, and seeing what's going on. You can test the cartilage inside by doing specific positioning to kind of twist and rotate it a bit and get a better idea if this is occurring. So if this has happened, what do you do? Right? How can you help that if it's contributing to the knee pain? Well, it depends on the degree of tear and the amount of looseness. If it's torn, but if it's completely torn, you need surgical repair for sure. And so you wouldn't start with us in that case. If this was a lower grade of tear and surgery is not recommended, then we could absolutely work with this. And here's the thing: after surgery, you really would want to consider some of the things that I'm going to talk to you about today. Okay, so these ligaments, they do not have very much blood supply directly to them. Most of the ligaments in your body, they connect bone to bone. Okay, that's how they work, and they stabilize joints. So if a ligament tears, what happens here is that it will create some instability or looseness in the joint, and that will cause breakdown and degeneration. So what we will do with this, let's say that it's not bad enough that you need surgery, but it's still creating some problems. So exercises are going to be recommended to try and strengthen the musculature, the muscles that can stabilize the joint. What I would suggest that you do is, in addition to that, what you do is we use laser therapy directly on the knee. And we use laser therapy to help decrease inflammation, improve healing, and really just help the overall joint function. So it has a lot of different benefits. Decreases inflammation, improves circulation, which brings more oxygen to the area, and has been shown to improve energy production of the cells of your body so they can have a high rate of metabolism. And that could translate here into a faster repair and healing. So if it was not a surgical, you were not a surgical candidate, then I would definitely use laser therapy and some of the advanced therapies that we use to help. Primarily, I would optimize your blood chemistry to make sure you have everything you need to heal properly. Step 1. Step 2, advanced therapies. I would primarily use laser therapy here. Now, if you had surgery, right, you had surgery, you're going to have a surgical repair, but you want to speed the healing process, what would I do? I would say, okay, when your surgery's done, come in, let's optimize your blood chemistry and get you in the best position possible to help your body heal, and let's use advanced therapies like laser therapy on the knee. Okay, that's how we would approach this. So this is a really important cause of knee pain. I mean, this happens to a lot of people where they damage the ligaments or the meniscus is damaged. We work with the meniscus quite a bit. The meniscus is a bit different. It's more of a cushion than it is a stabilizing cartilage. And we use a slightly different approach. We still use laser. We use our pulsed decompression. We do several different things here for the meniscus, but these would be some of the things that you should consider. These are alternatives or complementary to some of the other potential things out there. You know, some people are recommended oral medications that can have a lot of side effects. They are recommended injections that all these are useful tools, but you have to decide, you know, exactly what you want to start with and what you want to do. If you're doing injections, you just have to know that it takes minerals out of the bone. If you get cortisone injections, it demineralizes the bone. It also will weaken and degrade the surrounding tissues. So repeated cortisone injections can actually create problems for joint integrity and can weaken the joint itself. So there's a lot of different things to consider, but all things that you should consider prior to having surgery, prior to doing more invasive procedures like stem cell therapy and some other options that are out there. So we want to try to make sure we have a good understanding of what's happening and address the actual problem, because a lot of things can cause knee pain. So, you know, we would obviously start with a good exam and history. If you've already had your knee worked up and you know a lot about what's going on, that's helpful. But then we could determine and come up with a strategy to see if we can't help you. If you're interested in, you know, getting my opinion on your knee or how we might be able to help it, just reach out to us. We'd be glad to give you. I'd be happy to give you my opinion. You can go to hickoryspine.com and click on knee pain and learn about our knee pain program, or you can just call my office at 828-324-0800. My staff will be happy to help you out. But I appreciate you guys. Hope you have a wonderful day. If you have any questions, comments, post them here below the live stream, and I'll try to answer them as soon as possible. But I appreciate you guys. Have a great day.